Okay. Now, the other thing that I think we don't pay very much attention to is the impact of the actual removal. Because I'm going to be focusing on kids who are in the foster care system, okay, who've been removed from their homes, are living in somebody else's home, are living in group homes, are living in residential treatment centers, all right? When kids are removed from their homes, even if their homes are problematic, they lose many, many, many significant connections. When you think about moving out of your home or having, if somebody had made you move out of your home, at whether it would have been at age 5 or age 10 or age 15, you need to think about what you would have gotten disconnected from had that happened. It wouldn't just be your immediate family, although that's huge. Who else would it have been? Where else would the disconnections occur besides the immediate family that you're taken out of?
Schools and
Schools.
Schools and just going to say like teachers and all.
Yes, schools, teachers, classmates, the procedures in the school, the whole thing that you're used to in the school. It's like if somebody takes you out of your current workplace and suddenly one day just puts you into a totally different workplace. This is going to be a lot of adjustment, okay? Now, and I know that happened. I saw people looking at it. I know the division traumatizes its own staff that way. No, I'm very serious about that. That's no joke. So I see the looks there, and I just want to acknowledge that I'm aware that that happens. What other losses occur when kids are pulled out of their families?
Well, just the environment, the neighborhood in general.
The neighborhood, friends, neighbors, people in the community that are familiar to them. What else?
Extended family.
Yes, this is huge. Extended family. There tends to be a lot of attention paid to, well, okay, we remove the child from mom, let's make sure the child gets to visit mom, and we forget about the fact that many children are really embedded in extended families and that those people may be as important to the child, may be greater sources of stability to that child, even if they cannot take that child into their homes. They may be available to do all kinds of things for that child in foster placement if we pay attention to that. So, the point is there's a loss, which often leads to feelings of depression, and there's also many forced adjustments. So as you move into a new situation, if you suddenly plunk down in a new job, there's a lot of anxiety about that. So we have sadness and we have anxiety. And then there's a lot of confusion and anxiety about what's going to happen. That entire time that that child is in placement, there's often a lot of confusion about exactly why the child is in placement and exactly what's being done to get a permanent situation for the child and what's going to be the ultimate outcome. And children are living with that state of confusion and anxiety. There are certain things I think we can do about that, and I'm going to talk about that. There are certain things we can't do about it. Okay, but there are certain things I think we can do to decrease that problem for kids. And then, another thing that we often forget about is that being a foster child is itself stigmatizing. That if other kids in the neighborhood know that you're a foster kid, there is something about that that seems negative, right? And so if a kid comes into the situation already feeling like there's something wrong with me, and now it's exacerbated by the fact that they're a foster kid, it just makes the problem worse. So I'm not sure that I want to get into a discussion about whether all of these constitute traumatic experiences, but I do want to say they are certainly additional sources of stress that make it that much harder to heal from clearly traumatic experiences. And all of this is compounded every time a child is moved. And we know that unfortunately that happens. That children are moved from one placement to another placement. And I will ask the DCPP workers in the back, what's the most common reason that kids are moved from one placement to another? Behavior, right? Behavior problems. The foster parent has it up to here and says, take this kid out of here, right? And I'm going to argue that most of the behavior problems that you see in those kids is the result of everything we just talked about. So we need to be really aware of the fact that all of these kids are coming into the system with trauma and stress, and if the whole system doesn't operate so as to relate to the kid with that understanding, we are going to further traumatize the kid. The kid is going to be further traumatized in our care. In medicine, we call this kind of thing an iatrogenic effect. If you go into the hospital and they treat you for something and you get sicker because you get an infection as a result of being in the hospital, even though supposedly you were going to go there to get better, that the treatment caused the problem, or an exacerbation of the problem. And we have a lot of that going on with kids in the child welfare system. Not any individual worker's fault. This is the way this whole thing operates. So we have to really think about how the whole thing operates. Okay, so now, again, I'm not going to go into details about acute trauma and complex trauma, but I'm going to tell you that the more complicated the trauma, the earlier, the more different kinds of trauma, the more likely it is that the effect is going to be long-lasting, it's going to be on multiple domains of functioning, it's going to affect the kid in many, many, many ways. And,
Susan?
yeah.
I'm sorry, for the sake of the undergraduate students, would you be able to give a very brief differentiation between simple trauma and complex trauma?
Well, that's why I just said, simple trauma is usually like a single episode. You were in a fire in your house, you were in a hurricane and your house blew down. Even something like the World Trade Center disaster is actually considered a simple trauma. Okay, it's a single event that was limited in time. There may be a lot of after effects, but the event itself is over in a short period of time, and most of the victims of that were adults. When we're talking about complex trauma, we're talking about multiple forms of trauma over years, usually during the child's development, done at the hands or not protected by the caregivers who were supposed to provide that. And one of the confusions we often have is we hear about in the media these very well-publicized simple traumas that are huge. I'm not minimizing their impact. They're huge. We don't pay attention to the fact that kids in the child welfare system have actually experienced a much greater event, a series of events. Okay. So these next slides, and I want to go through them pretty quickly because in certain ways I'm going to review it again when I get to trauma-informed care. These are the areas that we think kids are negatively impacted in as a result of this kind of complex compound trauma. The first one is attachment. They don't trust people. They see the world as dangerous. They tend to pull back emotionally even if they seem to be relating. They test relationships. They don't feel good about other human beings. Other human beings are seen as sources of problems, not as sources of help. The second thing is we talk about biology, because trauma, the impact of trauma is to create a sense of panic and terror in people. And if this is a regular experience that happens over time, your body and your nervous system actually changes as a result of that. And you develop styles of interacting with the world that reflect kind of constantly being on a heightened level of arousal. And your body is in a heightened level of arousal all the time. And as a result, people often, there have been now a couple of major studies that have looked at what are called adverse childhood events and the long-term impact on health. And the more adverse childhood events you have, the more likely you are as an adult to develop heart disease, cancer, diabetes, all these medical conditions. And it has to do with the fact that you're living in a chronic level of stress, and that is a bodily experience. It's not just a mind experience, it's a bodily experience. So we know biology is affected. Now this is a very important concept. It's really a core concept. This is what we call affect regulation, or affect is the fancy word for emotions. Okay, and what the literature is saying is that kids who have this kind of complex traumatic history have a lot of difficulty managing their feelings. Their feelings get aroused quickly, and they don't know what to do with them, and it disorganizes them. Now, let me give you an example of somebody who has a problem with affect regulation. The person who has road rage has a problem with affect regulation. All of us are irritated when we get onto the highways in New Jersey. There's not a single person who hasn't experienced some level of being PO'd on the highways of New Jersey. But for most of us, we are able to manage that. We curse under our breath, we turn on the music, we try to think about something else, we may even give somebody the finger, but whatever it is, it's over in a relatively short period of time, and by the time you get to wherever you're going, it's usually gone. You're not even thinking about it. But people who have problems with affect regulation are already in a heightened level of arousal. An event like that will trigger them to a higher level of arousal, and they cannot calm themselves. So they stay in this heightened level of arousal. And the result of that is actually what's, I should have put it on the next slide, but I'll come back to the next slide. It's on 2 slides later, which is behavioral control. That very often, as a result or connected to the problems with being so triggered, people have a lot of trouble not acting on impulses. And so they begin to do highly aggressive or self-destructive things. They don't know how to calm themselves. We hear about kids cutting themselves when they're distressed as a way of relieving tension. Now, for people who don't engage in that kind of behavior, that seems really bizarre. How could that relieve tension? But in fact, that is a piece of behavior that people who do it say, it kind of cut through the tension and brought me down again. So that's an example of problems with impulse control, because you can't manage the affect. You start doing things that are not healthy to do. Okay, let me go back to the one that I had to flip over here.